Today, I'll be talking about our machine learning project. This is group 38. I'm MPANGA MARVIN JOSEPH, my colleague NAKYANZI FARIDAH, and KAKOOZA Michael Owen, also part of the group. Our research topic is optimizing government resources in combating latent tuberculosis in view of ending active tuberculosis in Uganda using machine learning. So basically what we're trying to come up with in this case is that we are trying to come up with a machine learning model that is in position of identifying high-risk areas in Uganda where people who have latent TB are progressing into active TB. Okay, let's move on. This is an outline of what we are going to present to you today. As you can see, we shall have our problem statement, our research questions, research contributions, methodology, dataset description, and so on. Well, let me take you through the background and introduction. Well, latent TB is a condition whereby the person carries an inactive mitochondrial tuberculosis bacteria in the body. Or this person that has this bacteria is actually not active, and the chances of it showing signs and symptoms are very, very rare. So, but again, the chances of this person getting active TB are very, very high. And if not noticed at an early age or not treated at a very early age, this person is likely to get tuberculosis, and tuberculosis is very contagious. So as of now, the government of Uganda spends a lot of money on tuberculosis itself and then also latent TB. But me and my group members, we figured out that as of now, the government doesn't base on anything to actually provide resources to people that have, providing resources to these people that have latent TB or tuberculosis doesn't really base on anything. So what we're trying to come up with, we're trying to come up with a machine learning model that is in position of identifying high-risk areas in Uganda, whereby people who have latent TB are at a very high chance of getting active TB. So in this position, the government will actually be in position of spending resources to where they are much effectively needed, rather than spending them, based on feeling, or me saying that, today, this financial year, let's spend them here, let's spend them here. This way, the government will be in position of actually, solving the issue to its highest position. And in this way, it will actually reduce its budget on the money it spends on treating tuberculosis itself. And I feel like this is a win-win for the government. Well, to move on, as you can see, let me explain our related literature and studies. Well, as you can see, based on statistics, there was a very, very sharp spike in the cases of active TB in Uganda, and these cases rose from in COVID-19, there were around 29,000 cases, and by 2024, the cases had risen to 72,000, and this is a very, very high risk. So you see what you're trying to there's really a very, very huge need of the government actually solving this issue so that it can actually spend less on these resources. So our machine learning model we are trying to do will be in position of solving this issue. So let me pass on to my colleague NAKYANZI FARIDAH to explain the remaining parts. I remain MPANGA MARVIN JOSEPH. Thank you. Today,
hi everyone. My name is NAKYANZI FARIDAH. I'm in machine learning group ML-38. I'm going to take you through the problem statement of our project. So here we have the domain application problem, and it says, while Uganda has successfully achieved the TB preventative treatment coverage for people living with HIV, a massive prevention blind spot remains for other high-risk groups like household contacts, minors, and prisoners. So what it basically means is, in Uganda, we have tried to prevent TB using the TB preventative treatment covering people who are living in different subgroups, but then we have failed due to the blind spot of knowing which exact subgroups are of high risk of attaining latent TB into active TB. And then Without a recent national survey prevalence, the Ministry of Health lacks the ground truth to see the full extent of the latent TB reserve here. Ministry of Health is lacking the ground truth that is coming from surveys, PDFs, to know which exact locations, which exact demographics are going to be having high latent TB so that they efficiently allocate resources there. Yeah, and consequently, limited TPT, the TB preventive treatment resources are distributed based on the general population density rather than clinical risk. So the main problem here is we are going to guide the Ministry of Health where to allocate the resources of the TPT instead of just giving out resources to the general population density. They should get ground truth based on the clinical risk that our model is going to be able to provide. Yeah, the reactive approach allows latent infections to wake up into active TB, fueling new community outbreaks and stalling Uganda's progress towards the 2030 NTB targets. Yeah, our domain application problem is going to, in a summary, it's going to help the Ministry of Health get the ground truth of the latent TB infection in Uganda. Going to provide the demographics subgroups so that the resources are efficiently allocated and optimized. The computational problems we got were the prevalence estimates. We realized that when we were looking for data sets, there was no recent national latent TB infection survey. We realized that there was no recent national TB infection survey that was found. All of them were got from the local studies, and they were from PDFs got from online resources. And another problem is the data gaps. We found that we started with using a data set that is of 2014 to 2015. So it does not provide up-to-date data on the latent TBI prevalence. The other computational problem was the search limitations. And there was also no integrated mathematical framework to fuse these heterogeneous data sets into a single predictive model. We realized that we had PDFs, and from the models you're going to train, they require tabular data rather than PDFs. So another slide has the research questions and objectives. The research questions here were, what is the current prevalence of the latent TB infection in Uganda's population and in key subgroups? What host or behavior or environment factors predict the progression of latent TB to the active TB? We also ask ourselves, are the geographic hotspots of latent TB infection in Uganda? Are there geographic hotspots of latent TB infection in Uganda that should be prioritized? And also we ask ourselves, can predictive risk models, for example, machine learning, be developed to identify which individuals with latent TB are most likely to progress to active TB, which demographics, which subgroups? So those were the research questions. And then our objectives are going to be to measure the latent TB prevalence in percentage in the general population. We are going to compare the prevalence by subgroups. For example, HIV status, age, or occupation, in order to identify the high burden cohorts. We are going to identify host factors. We are going to identify the geographic factors, which districts in Uganda have high latent TB infection prevalence. And also we are going to correlate these hotspots with the social, economic, and the environment factors. These districts are going to be correlated with the factors that are going to influence latent TB into active TB. Then the next slide. The research contributions and outputs. The research contributions, we were able to estimation of latent TB infection prevalence across the Uganda and high-risk subpopulations. This addresses the requirements. Research question 1, and then you're going to identify the major risk factors driving the progression from latent TB to active TB. We were able to identify that it was HIV being HIV positive, discovery of spatial or temporal patterns of TB transmissions, and also we are going to clean in the next steps. We are going to clean and de-identify data sets so that we get data that is going to be suitable to train our models. The research outputs here, we're able to get visualization by subgroups, showing the latent TB infection prevalence. We're able to get hotspot maps of TB incidences and latent TB infection prevalences. Those are the few of the explorated data analysis visualization you're able to get. So here is the methodology and the system architecture. This is going to show the workflow of our work so far, our project, and it sets the data sources. We're able to identify data sources of TB surveys and health records from WHO. We're able to get the National Prevalence Survey. We're able to get the Uganda National Surveillance surveying the treatment of latent TB in Uganda. Then we were able to collect that data in PDFs. All our data is in PDFs. We were able to pre-process the data that was removing noise and duplicates, feature selection, and cleaning the missing values. And from the data that we got, we were able to perform an exploratory data analysis whereby we got 25 visualization performed. We were able to identify trends and patterns of TB with the different districts in Uganda, and we're able to identify and understand the risk distribution of latent TB in Uganda. Feature engineering is going to be our next step. We are going to encode categorical data. We're going to normalize or scale features so that they fit into our model development process. We are hoping to use models, for example, the extreme gradient boost. We're going to use the DB scan. We're going to use principal component analysis model. We are going to use many models to learn these risk patterns. We shall also be able to do model evaluation. After model evaluation, you're going to predict and do and perform risk scoring, whereby you're going to identify the high risk latent TB group, predict progressions, and predict progression to active TB. You're going to get visualizations and outputs in form of a dashboard and charts, TB hotspot maps. And these are going to provide reports for decision-making by the Ministry of Health in Uganda to optimize resource allocation in terms of treating TB in Uganda. Then, yeah, our outputs will be used by the public health to perform early intervention to prevent latent TB into developing into active TB, and also to guide resource allocation. Basically, those are the few that our model is going to help with the Ministry of Health at the end of the day. Yeah, thank you.
We are going to see that in the training of models, it is so best for the statistical knowledge it gives for mathematical training and probabilistic model training. We have the WHO Global TB Report of 2022. This is a snapshot of the epidemiological survey made, because TB, being an immunizable disease and being an epidemic in this country, this data set had an estimate of over 91,000 cases. Then we have the National TB and Leprosy Program, NTLP, Annual Report of 2023-2024. This is an aggregation of data TB across the country. This is best important in clustering models, and it helps in the matrix models, as you will see. We talk about them later. The Uganda National Tuberculosis Prevalence Survey of 2014-2015. and yes, those are the ones. Of course, this one, we look at it being that TB is a co-infection of HIV, and we are mainly focused on the latent TB part, because our caveat is now looked at the people with HIV. So let us go forth to look at the output results. So when you come to the output results, the statistical part of it, we have a correlation heat map where we are looking at the HIV risk factors and the funding need score. But this one is breaking it further in different variables, including age, including sex, location, and so forth. Then the K-means cluster map. With this one now, we are looking at it at the point of looking for hotspots in the country. Where is TB most? Where is TB at the risk? The age, these locations, especially now like here in the metropolitan area, Kampala, Wakisomukono. Look at the remote areas. So this is for identification mostly, whereas the other one, it is for funding. Going further, we have another EDA output. This is for confirms that the 80-20 principle applies strongly in Uganda TB epidemic, where a small number of districts drive the majority of cases. For example, Mubende, Kabarole, Kagadi, Chibale. These are remote areas. Now, this is based on the point of identifying of the health facilities, whether they have the capability to treat the disease. So we have another one, which is the bubble diagram, bubble chart, highlighting a clear geographic pattern of TB risk across Ugandan districts. Of course, now this is also part of the point of matrix where we look at the different variables. So here is for hotspots. So you see like Busia, Busiki, Bundibujo, because of now health facilities, are they able to treat this disease? Yes. So to continue, of course, we have also the population count, considering the different sexes, male and female, even over different ages. You see that the elderly at a point of having lower TB than the young. The young factors coming from that in some areas immunization is low. Secondly, also the rate of HIV among the youth is high, and so on and so forth. So at that side is female being blue and male being female being red and male being blue. So here you are seeing that the age 15 to 24 is forming the largest segment for both and female and male, strongly dominating the risk factors of tuberculosis. Then we have the funding, the 24-month funding projection map, and of course the gap is $6 million, but the previous speaker earlier talked of that this is mostly funding money coming from donations. So the government is uncertain on the money, how it is spent well, so we have to optimize it so that it is used very well. So to go to the conclusions, let us look at the important TB risk factors such as HIV prevalence symptoms. Yes, that is the people that we are looking at. And the exploratory data analysis helped us understand the structure and characteristics of the TB data sets. The initial analysis revealed